here to engage with us and take us through this discussion. And I have a couple of reminders to make that as you are attending, please remain on mute if it's not your time to speak, kindly. And also for the members joining us right now, please remember to edit your Zoom names so that we can know who is joining us. There seems to be a technical problem that a few of us joining have the same name, whichever the technical problem is, but kindly edit your names so that we are aware of who is joining us. So that we don't take too much time, I want to welcome Christine, who is the moderator of the first session, to take it away right now. Christine.
Thank you, Nicholas, for that very warm welcome. And good evening. I'm tuning in from Nairobi, Kenya. It's a pleasure being here this evening for this wonderful dialogue. My session is labeled Lessons Learned in Handling COVID-19 on Our Continent, a very important topic. I know it's past tense, lessons learned, but it's still lessons we are learning. I have the pleasure of introducing three panelists who come from different walks of life, who will be speaking from three different perspectives. One is the socio-economic one, second is public health, and then third is leadership and strategy. So without further ado, I'd like to introduce the panelists today. Our first is Dr. Andrew. And Dr. Andrew Alola from the University of Vasa, Finland, earned his PhD in economics and a Master's of Science in Applied Mathematics and Computer Science, both from Eastern Mediterranean University in Northern Cyprus. His undergrad is from University of Ilorin in Nigeria. He's currently serving at University of Vasa in Finland as an assistant professor in the Department of Economics in the School of Accounting and Finance. One interesting fact about Dr. Andrew is that he was named in the Standard University's top 2% global scientist lists. Thus, he's emerged globally as a 704th and 1,972nd scientist in the field of energy and environmental, respectively. Those are quite a few numbers there, but we welcome you this evening. Dr. Andrew, if you could wave to our audience before we begin our session. Thank you. Then we have Dr. Gloria Nandwa Al-Hassan, and she is located in Turkey. She's currently a PhD candidate in the advanced stages of her dissertation in the Faculty of Pharmacy in Cyprus International University. She served as a research and demonstration research assistant at the same university, and she obtained her master's and her bachelor's degree prior to that. Something very, very interesting about Dr. Gloria is that she successfully established the first functioning drug information center in North Cyprus in late 2020. She and her team and other medical experts are currently running its telehealth base. Dr. Gloria will ask you also, I'll ask you to wave to our audience, and thank you for being with us this evening. My third panelist is Dr. Maureen Fahinde. Dr. Maureen has a very interesting background. Her research background and interests are in sustainability, leadership, policy, culture, behavioral change, and rural community development. She actually has several active research projects addressing these areas. She's presently a lecturer in leadership, sustainability, human resource management, and organizational behavior at the Department of People and Organizations at Bournemouth University Business School, United Kingdom. Something very, very interesting about her is that she has a very diverse background where she has created a diverse selection of disciplinary, diverse range of management courses in these fields. So if you would listen, this is very interesting. Oil and gas, energy, finance, accounting, law, and fashion management, both at postgraduate and undergraduate levels. Dr. Maureen, welcome. If you would wave at our crowd here today, that would be amazing. Welcome. All right, so let's jump into our topic this evening. And I think being that the founding fellows of the African Public Policy Network really have a love for economics, I think I'd love to start by talking to Professor Andrew and asking you this question as we begin. Professor Andrew, we would ask you to please break the ice for us. And then if our other panelists, Dr. Maureen or Dr. Gloria, have something to add to the question, please feel free to do so. So Dr. Andrew, we're talking about COVID-19 and the lessons we've learned on the continent. From the economic perspective, as it relates to Africa's trade and investments, such as the African Continental Free Trade Area, our small and mid-sized enterprises. What have we learned and what is the impact that has been made on these particular areas of trade? Welcome, Dr. Andrew.
Yeah, hello. I don't know if you can hear me clearly. Okay. Yeah, thank you so much for this opportunity. I'm really glad to be here. And when my brother, Festus Adedoyi, hinted me about this webinar, this interactive section. So all I needed to do was to just make inquiry about the composition of the people who are responsible or pioneering the project. And it's so interesting and to find out that it comprises of young people like me. So and that was what got my interest. And I didn't even bother to ask him for that question, than to say, okay, yes, I'm in. And I really appreciate what you're doing in the African public policy networks. I mean, the main reason why I so much appreciate the fact that it comprises, I mean, the young people like my age are the one pioneering this network is because for me, from my own personal perspective, I've concluded that we have, if we say leadership, or if we say the political elite failure in Africa, in a way to put it. So when I see an opportunity to interact with young people, I mean, people of my age or people who are much younger, I really find it an opportunity to be part of the discussion. And so once again, I really appreciate this opportunity. So regarding the lesson that has been learned, like you said, not that has been learned, the lesson that we are learning, okay, from the COVID pandemic situation, because right away we just recently got the information of the new variant, the Omicron variant. So precisely for Africa, if I may just go straight to the question, I think one aspect that I think the Africans should look inward and try to see what they could do is in the aspect of over-reliance or dependence on foreign trade partners. Okay, so when I mean foreign trade partners, so specifically referring to foreign states or countries that are outside the African continent. You could see that most of the African countries are heavily relied on trade with China, for instance. Okay, maybe with other foreign countries as well. And the repercussion to that, especially in the pandemic period, is because we could see that most of our import, especially import in food items. I'm a Nigerian, so most of my talk will be, I might be involuntarily mentioning Nigeria, for instance. So I want to use Nigeria as an example, for instance. In Nigeria import almost everything that we use or they use in the country. We could say Nigeria is an agrarian economy. I mean, in theory, but in practice, is it so? I doubt if that is actually so in practice. So imagine if we do import most of the goods that we use in Africa, and most of this importation comes from maybe foreign nations. And you know that the pandemic, so to say, has been somehow I really don't want to say favorable, but not too disastrous to the African continent. as it may have looked or as we have witnessed in other foreign nations. So as the pandemic has terribly hampered those economies of those foreign nations, somehow it has been a serious blow to most African economy, and especially some of the basic needs that the African people need. Some of these basic needs could have been produced within the continent. Okay, so imagine some of those basic food that we're producing within the continent, and God so kind, we haven't had such a disastrous impact from the pandemic. So in that way, it wouldn't have, the African continent would have suffered so much from the pandemic situation. So the over-reliance or dependence on foreign nations in terms of trade is one of the lessons of African continent need to learn from this situation. And that will really, I would just want to give credence to, or kudos to the African Continental Free Trade Agreement that is coming on, or that just started this at the beginning of this year. If that we progress well, that indeed will be a game changer for Africa. Thank you so much.
Thank you, Professor, for that key point of over-reliance. In fact, the OECD has found that one of the biggest and most worrisome impacts from COVID-19 shock, that is lower trade and investment from China in the immediate term. So I think you're right on the money with that. My wonder is if perhaps, I think Dr. Maureen has expertise in the leadership and strategy area. I wonder how you feel the informal sector has been affected, due to COVID-19 and jobs. Perhaps you can highlight that, because I feel it's tied to what Professor Andrew was speaking to just a moment ago. Dr. Maureen?
Thank you very much, Christine. Again, I'm so thrilled to be here. Just to piggyback on what Dr. Andrew have just said right now, this is a very important platform that we have to have this sort of discussions and narrative going. As I said, from youth sort of perspective, it gives us a view of what we can do, and sort of engaging in this sort of conversation helps us to start thinking critically on some of this issue. So I'm very pleased to be part of this discussion. Thank you very much for inviting me. So in terms of the impact on the informal sector, it was, it's no news that it was very devastating. So it was a very, appalling impact. So people losing their livelihood. And this, I mean, from when I talk about the informal sector, which according to research constitute 89% of, the jobs in Africa, which is quite, worrisome, because this brings us sets us back in terms of poverty index and stuff like that. So the impact that have been very, very, very grievous, as if you permit me to use the word. So in terms of the specifics, though, I'm thinking about our social structure, so social support, insurance and social support, savings and things like unemployment insurance and things like inflation. So when we are talking about how this set of people have lesser disposable incomes, and then we are further impoverishing them by the huge inflation as a result of the back-off effect on lockdowns and restrictions and those sort of impacts, causing more devastating issues there. Well, I think for me, the sector, in terms of the informal sector, so we have the small businesses, right? For me, the people who were really, in my view, that have been impacted are the such like, the everyday people. So I had a list of the most, impacted people here. I said people like, the restaurants, in the retail shops, the hairdressers, the taxi drivers that that normally rely on everyday income, to survive. And then we're talking about people like the street vendors, the cat pushers, the waste because even the petty traders, everyone was not left out. So it was like a huge impact on everyone. So mainly, as I say, it's economically. So in terms of source of revenue, to just keep their body and soul together, as they will say. Yeah, that was a huge one. So but as this conversation goes on, things will piggyback on some of the questions. But just to answer your question directly, so in terms of the impact, so these are the set of people who have been impacted. So the lists are quite long. So it's interesting. It's important for us to know exactly who we are impacting, because then we know what sort of solutions and recommendations to target these people directly.
Well said, Dr. Maureen. That's very well stated. And it's interesting when you talk about, people and culture being affected, because that's what it is, right? So their livelihood is part of who they are and their culture. I'm wondering from Dr. Gloria Al-Hassan's perspective, when we speak about these effects of COVID-19, yes, the informal sector has been affected, their small businesses, their ability to earn, but what about their mental health? It's a least spoken topic on our continent, but I think very important today. And I wonder if you could shed the light on, what you feel in your personal perspective and professional capacity. To what extent has COVID-19 affected the mental health of Africans? Where do you see this?
Can you hear me? Okay, thank you so much. It's nice to have I'm so happy to be here, and all the member of Africa Public Policy. Thank you so much for having me here. It's a pleasure. Talking about the mental health of Africa, I will say it's hit Africa so hard actually, because presently I conducted a study. I'm involved in a study since last year about the impact of COVID-19, specifically about the mental health of the individual. And according to the study, we discovered that 70% of people have been affected. You can imagine there are negative outcomes seen in the mental health of people that arises for the mental health of individuals. We can see something like increase in gender-based violence. Then we see psychosocial impact of the pandemic on health workers. On health workers, we can see this on health workers, because this study was actually a key informant interview and focus group interview. And when we interview the health workers, they specifically say it out of how the pressure of the COVID-19 have impacted them mentally. It has strained them, it has put mental strain on them, the mental strain, the emotional stress, the psychological issue, including dissatisfaction from the public themselves, the publics were not satisfied, and then the mental stress of the indirect effects of COVID-19 itself. Because talking about COVID-19, we have the direct effects and we have the indirect effects of COVID-19 itself. The indirect effects of it is in a way that we see people that are not even affected, that are not infected. They can't go to the hospital. They can't reach out to the hospital. So this is like a mental stress to them. And then we see increase in mortality, the increased mortality rate in the indirect effects of COVID-19. And then not having enough medical equipment in the hospital, actually it's a big mental stress in the healthcare system itself. So I'm talking about the public, the mental stress in the public. It's actually surprised me when I see the increased rate in gender-based violence. All these were caused because of the national lockdown. The people have nowhere to go, so it creates one issue or the other. The wives beating the husbands beating their wives, and so on. So the increase in the mental stress was actually it's cause for a cause of concern. Actually, it's cause for a cause of concern. So According to the study that we made, it's more of like 70% of Africans were affected mentally. Then talking about the income itself, because we can see that there was an increase in demand, and then we have decrease in supply. So the income that was not flowing also creates a mental stress on the stress on the individual as well. So thank you.
Thank you, Dr. Al-Hassan. It's interesting you tied it to income and the decrease in supply and increase in demand, because that's the reality we've seen also here in Kenya. And it makes me think of a question about debt then, and this is for Professor Andrew. Then in thinking about income, you have to also, it goes hand in hand with debt. So in thinking about how African, maybe nations or different countries chose to respond to COVID-19, what do you feel their debt trajectories we might expect, going forward from African countries? So they've had to procure, obviously, vaccines. They've had to offer, education. So there's a lot of debt associated with the response to COVID-19. Where do you feel that will put African countries in terms of their debt?
Yeah, thank you so much. The debt trajectory in Africa has been a serious concern. You see, and even before the pandemic, that has been a very serious issue among the African states. And there are so many reasons, we could point out so many of the reasons that may be related to reliance on natural resources, especially for oil income African states. I was trying to go through the debt profile in Africa. So what I found was that in the first 10 countries that has the highest domestic debt in Africa, the first 10, it will shock you to see that I think about 8 of these countries are oil producing states. You see, you will see countries like Sudan, for instance, Cape Verde, for instance, Libya, for instance, Angola, for instance, Congo, for instance. All these states are oil exporting, oil rich and oil exporting countries. So the question we should ask is, so you have so much oil resources or natural resources and you accrued so much debt, and that we just make us to look deeper to, how those African states, use those resources or those revenue accrued from oil. That is an issue of governance, issue of corruption, for instance, mismanagement, and lack of, misprioritizing what needs to be done and what shouldn't be done. So there are so many of those, okay? So all those has been going on even before the pandemic, okay? You see, when you talk about corruption, for instance, or governance, for instance, Africans are always mentioned. This is not about, so many Africans might be tempted to assume that the foreign nation or the Western nation are just too quick, to point out to Africans as in terms of negative virtues or issues like corruption. But that might not really be the case. We are Africans, so I think we are the best to tell our own stories. So for instance, I'm a Nigerian. If I don't need any foreign nation to say Nigeria is a corrupt nation. Me as a Nigerian, I will boldly say that Nigeria is a corrupt nation because we don't seem to have a very transparent system. So that being said, prior to the pandemic, the debt profile has been a serious situation. So now we have the pandemic situation where aside the oil producing states, most African states also rely on migrants' remittances. Okay, we have a lot of Africans, okay, working in diaspora working in Western countries, and most of us who live in foreign states do have one project or the other, have reasons to send money home. I mean, sometimes you actually see Africans who pay monthly stipends to parents, to siblings. I mean, these are realities. So with the pandemic, when some of those migrants who have lost their job, who don't have those means of livelihood or during the pandemic, that actually affected the remittances as well. So with so many other issues. So, and with recklessness of our governments, I mean, in different countries, I mean, depending on the countries that we in question, but a country like Nigeria, for instance, has been attempting or trying to fight corruption for who knows. But the fact is, the system is endemic in corruption. So, the profile is really growing so unimaginable. Like Sudan, for instance, I think is the most indebted country in Africa. Okay, and the profile and the debt profile of Sudan rose by about 200 and almost 300% as at last year. Okay, Angola more than 100. I mean, among those first 10 in Africa, first 10 indebted countries in Africa, about 7 of those had their debt profile risen by more than 100%. Okay, so that is not good enough. So, but my point is that we shouldn't just even blame the pandemic for that debt profile. This is as a result of accumulated issues resulting from governance, recklessness, and so many other issues. Yeah, thank you so much.
Thank you, Professor Andrew, and I'm so glad you brought the issue of poor governance and historic practices as it relates to poor governance, because sometimes it feels as though we may be using COVID-19 as an excuse, right? So it's really important to recognize that prior to COVID, there may have been structures that were not working. So it makes me turn to Dr. Maureen on this issue of governance. So I think it's very important to discuss how African states, African governments responded or have been responding while handling COVID-19. And I wonder from your opinion, you know what leadership approaches or governance practices have been successful and which ones not so successful that we shouldn't be mimicking as it relates to this pandemic? Dr. Maureen.
Thank you very much. So when we talk about governance, talk about leadership, there are two. I look at it from a two perspectives. So the first one is what the governments try to do in terms of the sort of strategies they made effort to implement, ranging from debt relief, support to tax forgiveness and other sort of COVID panels. So, for example, again, Nigeria, once that pandemic hit, they had a presidential panel for COVID. The responsibility of the panel was to inform the nation of what, the latest, basically inform them of what, or educate them, as it were, of what the pandemic was what the sort of impact, how to adjust and how to adapt ourselves effectively. So now in terms of strategy, as I said, it's a two-way street for me, because I want to commend some of the good works, but also point out some of the negatives. So I'll start with the good ones. So in terms of that, things like granting loans, giving people, rebate, and setting that sort of early panel that gave information about what, the COVID-19 impact was and how to protect yourself and so on and so forth. That was good. But where the leadership made the mistake, or where the issues came about, was in terms of the makeup. So let's start with the panels that most governments set up. So some of them were just a set of panels that were constitute doctors and supposed federal agencies and ministries coming together to inform the masses of what the latest numbers. So I call it the number board. So they often come up on TV and tell us what the latest number is, and that's the much we got. But the makeup of that panel was one of the mistakes some government did. So when it comes to pandemic, it's not just about what people need to know, but how do you educate people? So there was lots of misinformation that circulated, which I feel was a huge, issue that came from leadership. So, for example, in my village, I'll use my personal example. My family thought curing COVID, you need chloroquine and this sort of herbal remedies, to cure this problem. And I feel because at the beginning, when this misinformation was circulating, no one, thought to nip it at the butt and, clarify it that these are the things, okay. So now at some point we knew we had to wash our hands, personal hygiene information was coming up, but then the misinformation was well spread, which I feel they didn't tackle that misinformation bit. So, but in terms of the makeup of the panel, so as I said, just makeup of, federal government connected people. So the grassroots, people who are key to driving message to the grassroots. So the likes of, state governments, the likes of, trade unions, community representatives, who are the key persons that will circulate this information back to the bottom line. These people were absent, absolutely. For religious leaders were brought in after like months into the whole pandemic. And, if the set of people were part of the panel at the onset, I feel that the sort of issues we had around misinformation around COVID would have been, addressed as much as possible. Also, the lack of evidence. So I feel in terms of leadership, yes, COVID-19 was a problem. The pictures we saw were of the, Caucasians, like the British, and telling us that, oh, they are the ones sick. And so again, in some part of the Africa, they say, oh, it's a white man disease, not necessarily that it's a global pandemic. So I feel that, again, going back to, talking about the narratives and when that message should have been addressed would have been something that, should have been, that struggle of putting clear policies and clear guidance in place was one of the key failures of leadership. But as I said, I won't finish without talking about the positive. So now, in the midst of all this misinformation, lack of directive, lack of investment and seriousness with this issue, there were some individuals or some leadership, but not at the federal level. So I feel the major failure came from the central. But when it came to the states, so state governments in some countries, again, using Nigeria as an example, did set some good examples. So for example, we had, I came up with my model of leadership that I thought worked during the pandemic. So we had the communicating form of leadership. So there were this set of governors that made it a point of duty to have these daily briefings, weekly briefings. And as the time passed on, it went on to monthly briefings. So we have what we call the directive leadership. So at that time, most people, as I said, one of the key responsibility of government is to provide evidence. So now this is evidence, for example, as I said, I wasn't aware of anyone who had COVID and come onto a government-recognized television to say, look, I had COVID, I was treated successfully, and therefore I'm back, I can reintegrate back into the society. So now there was this, invisible stigmatization, just like we had with the Ebola and HIV. So no one had COVID that was able to come out and say, I had COVID. And so that lack of evidence was something that I think leadership failed all across the board. So, but some governors, again, in Nigeria, were very good at persuasion. So persuasive leadership, where they were persuading people that, look, the confidence in the infrastructure of the country was, most African countries have poor infrastructure when it came to health. So getting people to leave private hospitals to come and use a government recognized institute, health, firms or health, escape me now. So health bodies and health centers. Yeah, that's the word, centers. So health centers, I think some leadership, again, using the Lagos state as an example, I think, the governor was really proactive in communicating, very, reassuring that, look, use the government approved centers. We have the oxygen there because at some point there was shortage of oxygen. So I think in terms of leadership, governance, really failed, Africans in terms of misinformation. So the misinformation that really circulated in terms of the treatment and whether that COVID was true or not in the first place, whether it was a reality, was something that the government was really slow to address as that pandemic went on. But not to say that there were some really good example. But one important point I'm going to make before just giving up the floor will be in terms of importance of collaborative leadership. So we didn't see that throughout the pandemic. So collaboration here, as I said, as it was a pandemic, that was very important. That is, the poorer of the poor was being affected. It was only fair that the government go beyond its ego of, oh yeah, you must use the inner caucus, looking at bringing everyone on board. It's not just providing information of the numbers of who is dying or who has gotten vaccinated, but educating people of what the realities are of the pandemic. For example, reminding people of the aftermath of what happens, what is life like after having a COVID, for example. If I were to ask someone, it's a very difficult thing to get some people to talk about. So that aspect of communicative leadership, is something I will rest on at the moment. Thank you.
Well said. Here, Dr. Maureen. I mean, reassuring leadership, directive leadership, persuasive, collaborative. You've named a number of leadership approaches, giving us evidence of them. And I think it's just very helpful to hear it named, because I mean, Africa is very diverse. And so there are multiple approaches towards how states or governments led. And my wonder for you, Dr. Gloria, is on this idea of integrated medicine, technology in medicine. You're in telehealth right now where you are in Turkey. Do you feel as though the technology in our public health systems is adequate for COVID-19? And if that's too obvious, what reform needs to happen? Because we've seen it's very different in the rural areas and in the urban areas, but what reform needs to happen, being that this is your area? How can you advise us and guide us in this area?
Thank you so much, Dr. Christine. Talking about the technology when coming to healthcare system, I feel Africa is lacking behind, actually. Africa is lacking behind when it comes to technology, because we are used to our traditional ways, and then embracing the new technology is difficult for especially the healthcare workers. They want to just stick to their traditional way, which whether we like it or not, technology is evolving. So we can't be lacking behind. We just have to embrace it. So presently, I would say the healthcare system of Africa as a whole is lacking behind. Although during the pandemic, we can see in like 2 countries, I think Ghana and Rwanda, where we see the use of drones and the use of robots. The drones were being used to take the blood transfusion to the remote areas. But then out of 2 countries in the whole continent, that's not just enough. Like in my country, we have the issue of the issue of telecommunication, especially in rural areas. So that's a big problem. Talking about the big data, having the information of people that have been infected or the people that have been vaccinated, it's a big issue. Like something like contact tracing app, to be able to monitor people, where they go, who do they have contact with. We don't have it in Africa. Then talking about healthcare software also is an issue. Internet of Things is important, but we see that in healthcare in Africa, we are actually lacking behind here, because Internet of Things actually ensure the patient's compliance with the quarantine requirements. But we see the people traveling and they say they quarantine them, but then they go about with their daily businesses. And that's what brings about all those variants we are seeing now, because you don't know who is infected. And then you said you're on quarantine and then you're mixing with other people. And then this, the era of this COVID-19 actually is the one that opened up the era of digital itself. So in other countries, we can see the quick transition of telehealth, telework. Even in Africa, it was implemented like telework. not telehealth, definitely. And then the online educations, we see how people respond to it was being used during the coronavirus threat, which is being used up till today, especially in educational. This reminds us that digital technology brings many benefits, which we can't run away from. It brings many benefits and play essential role in managing and reducing the risks that comes with the lockdown and with those viruses. So it is well known that information technology and the information system and technology itself plays an important role, which the healthcare system, the healthcare industry need to embrace. As Africa's presently, we are not ready. We are not ready to. I would say, sorry to say, we're not ready. We're not capable. We're not equipped enough to handle the COVID-19 itself, because telehealth plays a big role, and then the Internet of Things plays a big role. The contact tracing plays a big role. So I would say the healthcare system need to open up their mind, and also the public will need to be open up to the digital world. Thank you.
Wow, well said, Dr. Gloria. In the last 4 minutes, I'll just ask for Professor is going to be staying for the second panel, so I'll ask for Dr. Gloria and Dr. Maureen to just react to these 4 words when I mention them, because right now the hot topic of the day is vaccination. We've seen a lot of responses from the continent itself to very poor media coverage, and using new words such as vaccine hesitancy. So I'm going to mention 4 words and ask, what is your reaction? What comes to mind when you hear these words as they relate to COVID-19 on our beautiful continent? So the first word is accessibility. Second is equity. Next is affordability, and last is distribution. So first reactions, Dr. Gloria, and then close us out with Dr. Maureen in the next 3 minutes.
Okay. Talking about accessibility, as of 1st of December, this month, only 7% of Africans were vaccinated. That's a very poor number, actually. The whole continent, only 7%, which is really bad. I hope everyone on the platform is vaccinated, actually. So. I was listening to a news by the African Union president, and he said having access to COVID-19 vaccine has become difficult, actually. As usual, they push us backward, and then as the largest continent, also we need more of those vaccines than other continents, but then we don't produce any. But thank God, as of I think 2 days ago, we have our own vaccine, actually, which we can call the African vaccine. The Johnson & Johnson's license a contract to a pharmaceutical company in South Africa. So it's a good news, which I think they will be able to, everyone can have access to. So the main thing now is what Dr. Maureen was actually talking about. The people that are taking this vaccine can come out and testify to it, so that everyone can take this vaccine, because the myths that are going around, if you take the vaccine, you're going to die in the next 1 year and all that. So we need people, reputable people, to come out and testify to it, that in order to kill the COVID-19 itself and to stop creating new variants, the solution is just to take the vaccine. Thank you.
Dr. Maureen, any words on this? We would love to hear your voice on this as well.
Yeah, what I have to say is, I think Africa, we need to reinvest in our healthcare supply chain. So this is a big issue that I think will help address some of the issues, because I think that we need to be careful between availability of the vaccines and hesitancy, because some of the like for example, Nigeria, according to the statistics I said yesterday, only 6% of the Nigerian population have first dose and 3.3% second dose. So it's just, and the biggest issue, of course, is that the vaccines are not available in the first place. So, nations have to invest in both the international and the local supply chain to ensure that these vaccines are getting to where they are supposed to be. And I think one of the hesitancy reasons, and again, looking from my personal interaction with people, are the fact that, number one, I say it goes back to government educating, not informing, educating people as to the efficacy of these vaccines. So telling people that the fact that the vaccines, well, the rumor is that the vaccines are to wipe out the African population or reduce the African population. But the realities are that when there is technology and there is investment, then vaccines are developed more quicker. So informing people of the efficacy of vaccines is something that we need to emphasize, and also reassure Africans of the infrastructures that are available to get this vaccine to where it's supposed to be. So, for example, some of the vaccine needs to be stored in certain degrees. I'm not a medical doctor here, but this is what I've heard. So now people are saying, well, if it's supposed to be in minus 40 degree, how am I sure it's still good when it gets to me, remembering that we have other endemic issues such as electricity supply, issues and all that. So reassuring people of the, giving them confidence that yes, we don't have the best infrastructure, but the little we have, we are making do of that. So giving people that confidence to actually go. But then at some point, stamping your foot on the ground will be one way. So America started with persuasion, incentivizing. Well, Africa incentivizing is something else, but those sort of strategies will be very good to get people going. And at some point, mandating. So I've seen people, for example, mandating states to report daily on their COVID effort, not just something that they do because of political reasons. Mandation, getting key workers, as it were, to get them to engage. So supply chain, as I've said, is one of the things. Giving people that the infrastructure we have, though limited, can still act in a good capacity to get the vaccine preserved enough, and therefore they can trust the confidence of the vaccine they're about to take, if that helps in any way.
Wonderful, wonderful. Very, very well put. I saw Professor Andrew raise his hand as we're wrapping up the session. So Nelson, if you would allow, I believe he'll have our last word for this session. Professor Andrew, you're welcome.
Okay, thank you so much, Dr. Christine. Yeah, I just want to add that addressing those issues that you just mentioned, equity, accessibility, and all the rest. One of the reasons why, these are the issues why Africa also need to look inward. Okay, because as it stands also, it's not bad if we have at least one vaccine being produced in Africa. As you see, in the Asian continent, at least, China was able to produce their own vaccine, which most of the Asian countries are also using. In Europe, for instance, either Moderna, Biotech, or Pfizer, we have United States, North America, you have the one from United States. So, this is an opportunity for Africans to look inward. The leaders, the political elites that we have, to look inward and see how this could be addressed in order to solve those issues. Thank you.
Well said, and a wonderful way to put a pause on our first session. I'd like to just recognize our panelists once more for that very exciting, very thrilling presentation from you, Professor Andrew. I know you're staying on. Dr. Gloria Al-Hassan, there in Turkey, and Dr. Maureen Kehinde in the UK. It's been a pleasure being your moderator this evening for this first session. Now I pass it on for our second session. Thank you all.